is there any new information about anti-TNF medications having protective effects against contracting COVID-19 or the virus severity?
Yeah, it's an excellent question. So it comes back to that whole concept of that cytokine storm that we talked about before. So there are trials going on right now all across the world where people are using different types of anti-inflammatory type medications, many of them being monoclonal antibodies that block specific parts of the immune system, just like the biologics that many of the people who are watching this are currently on. And again, they're not using it, for example, to prevent you from getting COVID, or if you have mild disease. It's really in the sickest population. We don't yet have data from those trials to know that being on a drug works. That's information that we're waiting for. But what we're trying to do from data like from the secure registry is to look to see, once we have large enough numbers, we might actually start to see signals with some of the specialized immune blocking medications we have. If we started to see that there was a potential, not only just a neutral effect, but potentially a protective effect, that wouldn't necessarily mean that that drug was protecting people, but maybe it could give us a clue that we could design a randomized control study with that drug in that specific scenario. So the truth is, it's still too soon to know, but that data is emerging. And I just go back to kind of the scenarios where I showed you all the different peaks that were happening. I suspect in peak 2 or peak 3, months and months down the road, the big differences are we're going to have drugs like that at our disposal to use, so that the risk of having a bad outcome 6 months from now, I feel, is going to be much, much less than it is today.